Welcome, everyone. Thank you for joining us. My name's Tim Ralph, and I'm a managing partner here at Biltmore Capital. I'm delighted to introduce a distinguished guest, Dr. Stuart Burstin. Dr. Burstin is a former director of clinical and medical affairs for North American vaccine development at GlaxoSmithKline, and currently he's an HIV specialist at AHF Healthcare located in Philadelphia. Although this conversation today is not directly related to investing and financial planning, we wanted to give a platform to provide clients, colleagues, friends, and family to ask questions and educate oneself. Right now, knowledge is power in the fight for a cure, and we need to slow this COVID-19 pandemic. To give a brief background, Dr. Burstin is an internal medicine and infectious disease specialist, practicing for more than 20 years. He's been dealing with a broad array of diseases caused by germs, ranging from hepatitis to HIV to pertussis. And Dr. Burstin led a lot of the development for vaccines at GlaxoSmithKline, from the preclinical phases through stage 3 trials. And now he devotes his efforts to the care of HIV patients. Our conversation today is going to be really focused around the epidemiology, the mechanism of the spread of diseases, infectivity, and the duration of COVID-19. As I've been talking with Dr. Burstin here, he's actually, updating these slides and data minute to minute. We just got some new information in actually from the cases in New York, which, we're going to share with you here today. Beyond that, we're also on treatments, vaccines, and what we can expect from the medical innovation over the. And we've already compiled a number of questions from the CDC, questions from clients and friends as well, and we hope to address a lot of this. As we're going here, this is really changing quickly, and I think there's been a lot of information spread around the television, social media, and so we're really trying to really clarify a lot of these different things. What is the source of this virus? Does it mutate? Is this airborne? How does it spread? Does it stay on surfaces for a long time? Ourselves, who's most at risk? And there are other questions as well. Will the warm weather stop this, and so on? As time goes on here, and the federal government has been stepping in for the production and development of the vaccine, we thought it'd be a good idea to give a little insight also on how long this process takes for the vaccine and all treatments. So I'm going to pass the microphone to Dr. Burstin, but before I do, if you guys have any questions along the way, there is a questions section to the right of your screen, and feel free to enter anything or email myself or your advisor, and we'll do it. Now, without further ado, Dr. Burstin.
Just to have everyone start at a level playing field, coronaviruses are viruses that have been known for many, many decades to cause common colds. By that, it's runny nose, people don't get too sick and they get better. The virus grows in the upper respiratory tract. But then in 2003, people became very ill with a coronavirus that was named severe acute respiratory syndrome. They got sick very quickly, developed pneumonias, and had a high fatality rate. But because they got sick so quickly, they're easy to identify and isolate, and by public health means, we were able to stop the epidemic. Another of these type of coronaviruses began in the Middle East. It was less severe and less easily spread from person to person, and has been giving us some cases every few years. This new virus, which is called severe acute respiratory syndrome COVID for coronavirus 2, and that name is given to it because it's very much like the first SARS virus, began in December, and to understand how rapidly this has progressed, In China, over 10,000 people had been diagnosed by the end of January. It rapidly spread at that time to over 125 different areas in 23 different countries. That made it very difficult from the first SARS virus, and much more difficult to deal with, is that not everybody gets very sick, and people can be infectious when they're healthy. It's now estimated, as of yesterday, that 12% of the infections in China were due to people who had no symptoms yet. They became sick later. The United States is now faced with this, and first cases were here in January. We also confirmed human-to-human spread by the end of January, and now it's in all 50 states. Every number I give you today is wrong, and I'll explain why later. Over 7,000 cases, make that 14,000 by the end of the day. A couple of hundred deaths. It is now beginning to be seen in an exponential growth phase. What that means is, if you think about it, if something doubles, it goes from 1 to 2, but then 2 to 4, 4 to 8, 8 to 16. So the new number of reported cases will more than double every day. And right now, and this is critically important and why I say the numbers are all totally wrong, this is being underreported. In the United States, we had a long delay in getting appropriate testing. There are a limited number of tests, so the only people being tested are those who are sick enough to see healthcare providers and in an area where they can be tested. People who are calling, and this is from the CDC's recommendation as of now, with mild illnesses that might be a coronavirus, and that is somebody who has a fever, cough. It used to be with travel to an infected area, but that's everywhere now. Those people, if they're young, healthy, and have mild disease, are told to stay home, self-quarantine, notify other people who they may have contacted, and they may have coronavirus, but they're not counted. And that is probably the majority of cases. Case in point, in New York, these are the numbers. 3 days ago, 1,500. Yesterday, 2,300. And today, 4,100. That is a rapid increase. So you can see it's really doubling every day. And that's just the people who come and care enough to get tested. The other thing about this virus, which is not atypical for many infectious diseases, people at different ages respond differently. So if you happen to be under 19, in the United States, there have been no fatalities. There may be one now. There's very little data on young infants, though, and we'll have to wait for that to come in. If you're between 20 and 54, there's a less than 1% mortality. How much less, I cannot tell you, because the vast number of people in that age group will get sick, maybe asymptomatic. On the cruise ship where this was looked at, 50% of the people who tested positive had no symptoms. Between the ages of 55 and 64, there's a 1 to 3% mortality. Again, it will be lower. But once you get over the age of 65, mortality goes up very fast. 3 to 11%, and over 85, 10 to 27%. And I will predict, though I have no real data, that these numbers are closer to reality, because the older you are, the sicker you're going to get, and the more likely you are to be tested. So remember, this is based on a case definition that enables people to get tested, Minimally symptomatic people are underrepresented. The other thing to remember is that in this country, 49 million people are over the age of 65. So if you have a 10% mortality in the old people, or 3 to 27%, you can do the math. Okay, what do you do when you see a new virus? Well, first of all, you have to find out that it causes the disease. Then you have to develop a way to rapidly diagnose it. Once you know that, the next step is to see how it's transmitted. Some things can be. Then mitigation comes in. If you can't do containment, you slow or stop the down the line. Hopefully you develop a treatment and a cure. So what have we learned with this one? The Chinese rapidly defined coronavirus as related to the first SARS virus. There was some delay in reporting, but once the centralized government, it was very rapidly worked up by the scientific community. The virus itself was rapidly evaluated. Scientists there were able to make a molecular map of it, and from that they can really ascertain what it was doing. They rapidly determined that there was person-to-person spread, and the route was usually by coughing or contact. What did they do to stop it? They curtailed person-to-person contact. If it goes person-to-person and people don't see other persons, it doesn't go anywhere. And so the number of people who were infected from each person was over 10. By distancing, they've made that number go to less than 1. What does that mean? If less than 1 person gets the virus from an infected person, the epidemic will eventually die out. Now, they have some degree of control over the virus. However, remember, this lockdown cannot continue indefinitely. And one can anticipate there will be an increase in infections when people go back to normal. But if the number is low enough and the cases are found early enough, it may be able to be contained. How many people will eventually be infected in any country is at this point unknown. As you heard, Angela Merkel said 70% of the people in Germany. I think that's not an unreasonable number. So far, we don't know anyone who has natural immunity to this because we haven't seen this type of coronavirus before. Do not protect from this. And the worrisome thing that the coronaviruses that can reinfect the same person. We hope that doesn't happen with the SARS viruses. So we know it's spread by droplets, contact, and aerosol. When someone coughs, sneezes, there are actually large droplets in the air that fall down and they can stay on surfaces, and maybe up to 4, 5, 6 hours, they're still effective. The real worry is aerosol. The difference in aerosol is they're very fine particles and they go out when you breathe. So somebody can be not coughing, not sneezing. You don't have to touch anything, but the air you breathe may be infected. The CDC is not sure of that. That is a mode of transmission, but over 10% of people are infected from someone who's asymptomatic. Incubation period is important. When is a person who's been in contact with somebody with this infection no longer considered to be able to get it from that contact? 14 days. So it can be as quick as 2 days and as late as 14 days. What do people have? They typically get a fever. The definition of this infection is that they have a fever and a cough, usually dry at the onset. It can actually increase with time. and people can get short of breath. This may typically occur several days into the infection when the immune system kicks in. So that's a little unusual. So what do we know about it? Of the people who are symptomatic, fever and cough. Now, if you look at the data from China, 81% of the patients that they were able to diagnose had a mild illness. That means that they were looking at people with mild illnesses. We're not doing that in the United States. 14% had severe illness with about half of the lungs involvement by X-ray. And 5% of people had organ failure. These are people who are on ventilators and in the ICU. So what is the case fatality rate? How many people who get infected will die? That depends on how broad you look. If you look at the beginning numbers, when only the severe cases were being reported, it was around 6%. In South Korea, where they did a lot more testing of many people, their infection rate is last that I saw published at 0.7%, and I've heard now it's down to 0.5%. And in all the epidemics in all the countries, increasing age is one of the most common associations with doing poorly. And again, people under the age of 20 seem to do very well, though there have been reported fatalities, but they are very few. What can we do? I've already mentioned that. Social distancing can slow the spread of the virus. By social distancing, that implies 6 feet away, so that if they cough or sneeze, you're not likely to get it. Cleaning surfaces, and if it's person-to-person spread, the fewer people you're near, the better it is. So that's why the initial recommendations, which have been changing, are you don't want to be in a meeting with 250 people, then it's 100, then it's 50, then 10. And why is that? If you're in with 250 people and almost nobody in the place has it, you're less likely to get infected. But if 1 in 100 has it, well, if you have 30 or 40 people in a room, somebody's infected and they can infect 2 or 3 others. So social distancing, and the more people who already have the disease, the fewer people one should come in contact with. Now, a lesson from China is that when they began to be infected, they immediately developed facilities for people who were sick. They built hospitals overnight. So this medical facilities, as far as we know, were not overwhelmed. In the developed world, we cannot build things that quickly. And there's a limitation of the number of hospital beds per person, the number of ICU beds within the hospital, and the number of breathing machines, ventilators, that will be needed when people get very sick. In Italy, which is an epicenter in Europe, their medical facilities were totally overwhelmed. Physicians were put in a position of deciding who gets put on a ventilator and who does not. Nobody should ever be put in that condition, and nobody should ever be a patient for which somebody is making that choice. Italy has about 2 more hospital beds per person than the United States. So we may be in deep trouble. And with increased deaths and increased spread of the disease, there will be a prolonged disruption in our society as we know it. Well, where are we going with this? The future, as I pointed out, it would be nice if we had a treatment therapy. There are a number of compounds that were being repurposed that had been used for other things that were being tested. As of an article yesterday in the New England Journal of Medicine, one of those medicines that was used for HIV has been shown to be ineffective. There's another medicine that was used and tested in Ebola, where it was not very effective, is now being repurposed and used for the coronavirus epidemic. I'm much more optimistic about that because that medication was actually developed in a coronavirus lab for use against SARS and other things and seems to have a broad support. Unfortunately, when used in monkeys, there's an article that's going to be coming out, but it is available in pre-publication form, that shows that if you give it to the monkey before a challenge with the infection, the monkey does well. If you give it when the monkey is just infected, it may be a little bit better than not getting the medicine, but it doesn't seem to be doing that well. So there's some hope there. What about a vaccine? I'm afraid that to develop a vaccine, no matter how quickly you can construct the vaccine, and we now have molecular ways of building vaccines, putting them in vectors, using messenger RNA, all these ways of developing immunity. But to develop a vaccine where something is put in a healthy person to prevent them getting sick requires extensive safety testing, and not only that, you would like to know if it's going to work before it actually faces the illness. That is, you'd like to have something that correlates with how well it does. We don't really have that from coronaviruses, so we'll have to test it in people who might get infected. That takes longer. There are a lot of questions about this, and I'm sure you will have more questions. Number one, is this coronavirus going to go away when there's heat? Some people have hypothesized that based on the fact that respiratory viruses, and this virus goes in the upper respiratory tract, but also in the lower respiratory tract. That's why it causes pneumonia. Some of them are seasonal and they go away when the temperature gets warm. There's absolutely no reason to believe or not believe that will happen with this coronavirus, but I personally think the data would suggest that it will not go away, and because it has spread to the southern hemisphere as well as the northern hemisphere, we will continue to have this virus circulating. The second unanswered question is this like the upper respiratory tract coronaviruses where one can be reinfected? One can only hope not. So, some predictions, and predicting something that is starting with an unknown, which is rapidly changing by the day, is something that one would have to be a fool to do, but I thought I'd do it anyway. Okay? What do we know? I think we know that the rate of spread, and you've heard that discussed as the shape of the curve, whether there's a sharp peak and then it goes down, will be early or can be spread out. Can it be altered with different degrees in different places due to local governance? In China, they did it. In Italy, they didn't. I think to that answer is definitely yes. But the question is how well it can be done, and especially how well are we doing? Right now, we seem to have haphazard, everybody does it their own way, starting at different times, planning to stop at different times. In Philadelphia, where I practice, they started on March 16th, and they plan to continue to March 27th. Well, that's obviously inadequate. I don't know if they'll extend it. So we don't know whether these local interventions will be good enough. The healthcare system, especially ICUs, will there be sufficient room for the infection? If there is a rapid surge early, we are even worse off than Italy, so the answer is no. So the question is, can we put in effective social distancing to preclude that from happening? The other question, which is a corollary of that, will the total same number of people be infected, whether it's sooner or later? And the other question is, the old and the infirm will do less well. That's a given. But all of society is now being affected and harmed, as we can see from the economic fallout. So it's not just a medical problem. It's not just a social problem to protect people, but it's also an existential problem to make sure that our society will continue in a way those of us who have been lucky to have only lived in the last 70 or 80 years are used to. And people talk about these social distancing. We have to understand that China did it in an incredible way for months. Small ways and doing it for a short time will probably not alter what happens. You can expect over the next 5 to 10 days a rapid increase in the number of reported cases because testing kits are now becoming available. And there's no reason to discuss why they were not at this time. When there is a serologic test looking at people's blood to see how many asymptomatic people they have, we will get a much firmer understanding of how many people got infected and actually got sick. But that will take some time. So you'll see numbers going up. And remember, this is most likely an underestimate, especially in the young and healthy who may be asymptomatic. But I think on the good side and the plus side, we know already that there are some treatments that are in development. One is being tested right now, and I think there is a possibility there will be some benefit from it. And another medicine developed in the same lab is waiting to be tested. Vaccines are likely to be developed, but that is not something that's going to happen in the next year or two. Difficult to do, and I don't think that we will be lucky enough to have it done in a year, as some people have postulated. So I'll stop here, and I would like anyone to ask any question that they want to. However, I want you to remember that this is a rapidly changing pandemic, that nobody alive today has witnessed it. And this is the first time something like this is happening in the era of what we would call modern science. In 1918, when we had the great influenza, we knew very much less about germs. When the bubonic plague was going through the world, they knew nothing about it. So our treatment for this disease or prevention is equivalent to what people did with the bubonic plague. They isolated themselves. That's where quarantine comes from. So for all that's changed, a lot remains the same. But hopefully our scientific background and understanding how we must work in society will help us get through this. Jim, you want to open it up for questions?
Yeah, that's great. And Dr. Burstin, we were talking a little bit earlier about a study done by Johns Hopkins. Maybe you could just talk a little bit briefly about that and the modeling.
Sure. This is very important because somebody recently has said, who would have expected it? Well, it's been expected a long time. There have been models and predictions made, books written. I think there was one in 2004 and another in 2012, predicting a pandemic. The Army or the armed forces have told the government that the biggest threat to the United States is not terrorism or war, but pandemic because of disruption it will cause. They knew it. Johns Hopkins has had 2 simulations, I believe, One I'm definitely aware of that was done in the last few years, where they brought a number of people in and said, we're going to simulate an epidemic that will become a pandemic. What do you think will happen and what can we do about it? The virus they chose was coronavirus, basing a little bit on the SARS virus. And this virus is behaving similar to the virus that they modeled. They modeled it was a little bit more lethal. So I can only tell you that the outcome of that was terrible. The world didn't do very well then, and I'm not sure that we've learned anything from that, because some people are still saying, who knew? Anything else?
Yeah, we also spoke briefly about me personally, and I had kind of isolated myself in a way, just kind of removing myself from going to work and things like that. But you said that was an issue, and that you would actually send me out into the field. Why is that?
Now, this is my own thinking, and I'll start with what party line is. What people have been attempting to do belatedly is to slow the spread in the United States by decreasing person-to-person contact. Everybody who's not in a, by definition, necessary employment or other thing is told to exercise social distancing. Restaurants, bars, meetings, cut down, work being done now from home. And that has been across the board. And that's based on the assumption that few people are infected, and we will slow it substantially by having less contact. However, in a situation where many people are affected, it takes fewer contacts to spread the disease. So if everybody is isolated, the duration of time one can do that is much shorter than if you would put people who, and this is my thinking, not generally accepted, but if you would put people who are at highest risk in safe environments, either at home or in hotels, and let people who get infected, they're young and healthy, get infected. Some of them will require hospitalization and the use of ICUs, but the system will not be overwhelmed, and there will be a larger number of people with time in the population who are immune. So it will be easier to control. And so even though this is somewhat radical and nobody is doing it, I would hypothesize that may be a way forward. Right now, your local governments are telling you to stay home, only go out for necessary things. That is absolutely essential for anybody over the age of X. And that X will have to be determined by modeling. But certainly if you're over the age of 70, you should be at home. If you have underlying lung disease or heart disease, you should be at home. Those people have to stay there almost indefinitely until we have this under control. How long we can stop society and the economy in hither and yon is up to people much brighter than me about the economy. From what I'm seeing, it doesn't work very well, and we'll have to find an alternative solution. Does that answer the question, Ralph?
Yeah, that was great.
Mm-hmm.
And I had another one here come in from Michelle, and she had asked about people currently who may have been sick previously. The doctor has already put them on antibiotic. Are they less susceptible to this strain? Already on antibiotic, that is.
Okay. First thing to know is antibiotics, indeed any medicine that we have, is totally ineffective against the coronavirus. So the illness for which you have been put on an antibiotic may well be something that is susceptible to it, but it would be, if it's coronavirus and I have no way of knowing, and you have no way of knowing unless you were tested and you weren't, because nobody's being tested unless they're pretty damn sick, we don't know. So what do you do with somebody who has a cough and a fever, who is not sick enough to be tested by the current criteria? Well, first of all, what is a doctor going to do when you call the office? The current recommendations are that if a person is relatively young, relatively healthy, and not very sick, you tell them to stay at home, self-quarantine, keep other people away from them, and people who have been near them may have to self-quarantine also, so you don't want to spread it, and wait until at least 7 days and 3 days of being asymptomatic and then going out in public. We can look back on these people from their blood someday and see if they had coronavirus, but right now that's what happens. They're not tested. The doctor does not want them to come into the office because they will only spread the disease. So that person who has the call, I have no way of knowing what you should do except stay away from people, even if it was just the flu for a while, and be healthy for 3 days. If one gets worse in that situation, then local health department or others have to be contacted, and the person will have to be transported to a facility such as a hospital in special precautions in case they have coronavirus and you don't want it to spread, and tested there. This is medicine and healthcare in a way that has never been practiced in the United States before.
What if you have a spouse or another family member in your household who does come down with this, and the word self-quarantine, does that mean I'm on my own, or can my spouse or family member still be in contact with me?
The answer to that is a little bit dependent on a we don't know, but assuming that you are in contact with the spouse during their asymptomatic period, you have to assume, the person has to assume they are infected. And indeed, the probability of their being infected may actually be quite high. And why I say that is it seems to be fairly well transmissible. And so the person who has the disease, if they're documented, they're probably sick. They may even be in a hospital, but they may not be. So they're going to be quarantined, and the contact should be quarantined. That means not visiting a loved one in the hospital. So it is not a good thing to have. Now, how long do you wait to see if there are symptoms in that person? As I mentioned, it has an incubation period of 2 to 14 days. So that's 14 days of isolation. The other fact, however, is most disease presents within 4 days, 3.9 something. So if you don't have it early, you're probably not going to get it. How infectious is this? Will someone in the same house get it? I think that that's probable. We've seen a lot of spread. And there was one case in China that I find quite frightening. A woman had visited Wuhan at the beginning and went to another city. She worked in a large mall. She worked on, I believe, the 3rd floor. Everybody in her office became sick. That was 7 people, and 2 people in the floor above her and 1 person in the floor below. We assume they were all from her because they couldn't find any other point in contact. But the only contact that they could ascertain between the people on the other floors was using the same ladies' restroom. So it's pretty infectious. Wow. I don't want you to be too scared, but I'm never going out again.
Well, it's on that note. As as I'm going around here down in Florida, I'm noticing a lot of folks still going to the shopping markets. There's lines at Costco. What is your advice there? Or should we be refraining from doing any of that?
The party line, and as of this morning, Florida had 390 cases. But just to give you an idea of how underreported this is, the private labs have just started doing testing about this week. It takes 3 or 4 days for a test to be done. So the ones that have been reported so far were mostly from the Department of Health, 209 cases. The private labs were just started, already have 151. So the numbers will go up. I think one has to make a choice. And if one is out and about and you're young, don't go near people who are older if you can help it. They should be more socially isolated. Is that the right thing? I'm not sure. I have always said that I am always going to be logical. I may not always be right. So I certainly want people who are older to self-isolate now, stay in place, and have as minimal number of young visitors or younger visitors as possible. And for young and healthy people, it may well be that you're going to get it anyway. So unless your town is on lockdown, I would just try and avoid contact as much as possible. Certainly movies should be closed. There shouldn't be any concerts. I wouldn't go to a restaurant, bar, but I certainly would go to a store. Make sure that you get everything that you need just in case you go on lockdown. And again, I don't know if that's right.
But it seems logical.
At least I think it's logical. And the other thing that you should know about is what to do if somebody is in your office who is calling in sick because they have fever, cough, and they're at home and they weren't tested. The belief now is that prolonged contact less than 6 feet away is a risk factor for transmission. Anything else is not, and that we're hoping everyone is cleaning all the counters and stuff. So that would be the advice. Anyone who is in that situation should consider self-isolating. The others should not. The person who is self-isolating at home, if you don't know whether they had coronavirus or not, I would say that they should stay home a minimum of 7 days and 3 days after they are symptomatic. That's what we're suggesting for people who are documented with coronavirus. So undocumented, you might do the same thing.
Great. Well, thank you, Dr. Burstin. This was really excellent. Sorry, ladies and gentlemen, for the complications earlier, but I hope this was very informative for you. If you missed anything, we will have a edited replay for everyone, investors, friends, family, and colleagues on our website. You can also check out our Facebook pages and LinkedIn pages. And always with the markets, I'll just finish on this, is that if you do want to discuss your current financial situation, don't ever hesitate to give us a call. We are here for you. I hope you guys will all be safe. Try to adhere to a little social distancing as best you can, and please wash your hands. Thank you, everyone, again, and try and have a great day. Take care now. Thank you.
Thank you, Mr. Ralph, for giving me the opportunity to do this presentation.
Thanks, Dr. Burstin. Enjoy your day.
Okay.
Bye-bye now.
Bye.